So good morning, everybody. Thank you for joining us today. So this is the first of what will be a series of webinars as we introduce the next phase of development of the Health Data Research Innovation Gateway. With today's introduction, this will be very much an introductory discussion, and in future we will go into more depth around specific areas. Just for your awareness, we are recording this morning's webinar. So if you have a concern about this, please do disconnect. We will also be making the recording available afterwards. So if you have colleagues who weren't able to make this morning's webinar, please be ready to share the link with them. I know that some of you saw the minimum viable product of the gateway that we developed at the latter part of last year into the early part of this year. And this is really the next stage of that work. We started this phase on 27th of April with the first beta on the 2nd of June. It's evolving fast, so this is a nice quick introduction to give you oversight of where we are and where we're going. Next slide, please. So what I'd like to do is do some quick introductions. So the team that will be presenting today is some of the leadership team around the gateway from both Health Data Research UK and our development partners, PA Consulting. So I'm Jerry Riley, I'm Chief Technology Officer of HDR UK. Shashil, would you like to introduce yourself?
Hi, I'm Sushil Varma, I'm Director of Engineering, HDR UK.
Peggy?
Hi, I'm Peggy Bartes-Stride, I'm Technology Partnership Director at HDR UK.
Monique?
I am Monique Silva, I'm User Experience Designer at PA Consulting.
Rachel?
Hi, I'm Rachel Alsop. I'm also with PA Consulting and I'm the Programme Director for the Innovation Gateway.
So our agenda for this morning, as you can see here, is I will give a very quick introduction to what we're doing and why we're doing the gateway. I will then hand over to Shashil to work through a demo and hopefully a live demo of the gateway as it stands today. Peggy will then take you through the vision for where we're going, and Monique will take you through some design activity that we have been doing around some key features that are coming in the next few releases around collections and data access. And we will then open up for discussions with the whole of the panel. So there'll be plenty of time at the end for Q&A. And also, if you missed the Q&A, we will be talking about some of the collaboration features we have on the gateway, so we can continue that discussion afterwards. Next slide, please. So the journey so far, as some of you know, we went through an MVP phase earlier, and that was to shape out some of the ideas and thinking, which has then fed into the work that we've started. We're going to be delivering the gateway over at least a 2-year period. We have initial plans for the 2 years, and we're focused in on some initial objectives. And these are around improving search and discovery. You've really got to be able to have a much better way of discovering which data sets are there, whether they're suitable for your purposes. So we're looking both at simple search and some deeper search technology. Improving the access request management journey, so that not replacing what the data custodians are doing, but making that a much smoother journey, and in a journey that fits in with some of the models we're driving around trusted research environments. So we'll talk about how that's looking in a short while. But also to make the gateway a place where we all go to collaborate around health data research. We're a community, and so we want the gateway to be developed as a community, but we also want it to be a home for health data research, where you can go and have discussions about your projects, to have discussions of matchmaking, to have discussions about data sets and tools. So we want it to be a collaborative environment. We're developing the gateway in the open. It is all open source. We are using a very open approach to design, as I'll talk about a bit later on. And we want this to be very, very transparent. So these are our initial objectives. Our longer term objective is to really transform the end-to-end journey. So as we say here, we're on a journey. This is just a beginning. So we're looking to transform the end-to-end journey for research and innovation with clear public transparency. But this is very much a community-driven approach. We are pushing, we have a collaboration between HDR UK and PA Consulting, but we can only do this with content from the community and collaboration from the health data research community. So we want these webinars and drop-in sessions that we'll be running to be part of being a community effort to make this the best asset it can possibly be to make the UK the best place in the world to do health data research. So with that, I'm going to hand over to my colleague Shashil to take you through a quick demo of where we are today, and then we'll build on that with a conversation of where we're hoping to go. And we're 4 sprints in at this point, so this is 2 months of effort. So this is just, as I say, the start of a journey. Shashil, over to you.
Morning, everyone. I hope you can see my screen. So I'll just quickly run through what the gateway is today, and some of you might have seen the MVP we launched 3 or 4 months ago in February. So I'm just going to give you some updates as to where we are now. So this is literally launched on the 2nd of June, so a few weeks in now. And this is the landing page. So if you go to healthdatagateway.org, you will be able to see the entire landing page. So you get direct access to search. You see all of the statistics that we publish in the open. So the number of registered users, the data sets, the access request that's been made by users, the tools, which we need to improve continually with your help, and the number of searches we have in the last month. You can also see all the recent searches, and there's a live feed that comes in as soon as somebody makes a search on the gateway. The popularity, the recently updated content in the gateway as well. And most of the content is submitted by our Health Data Research Alliance members, who contribute most of the data sets into the Health Data Gateway. So considering it's COVID-19 and we're in a crisis, what we try to do, at least for this month and a few months now, we've been starting to collect COVID-19 related content. So COVID-19 related data sets, for example, so you can get direct access to all of the data sets that's there. You need to make a request to access these requests, but these are all the metadata that we've collected around that data set, so you can understand and possibly use that in your research. We have also published all of the papers that's been published by the HDR UK community around COVID-19, all of the research questions that we've been collecting to report to SAGE as we do so on a bi-weekly basis now, before it was weekly, and all the tools that we have in the gateway. Again, this is just a single landing page for all the COVID-19 related gateway resources. You can also make a search on the gateway, so you can type in, So type in COVID, and it'll give you all of the data sets that has COVID, for example. If I put COVID-19, that'll give you all of the data sets that has the word COVID-19, all of the tools that's available, and all the projects that's available as well. So these are all the research questions that we have in the gateway. You can filter on particular on these terms. So I'm just getting all of the data sets from the SAIL Alliance members. So these are all the data sets that's there. You can filter in tools and projects as well. So if I were to go into an example data set, so here, the COVID symptom tracker data set, you get high level metadata around the data set, so the description of the data set, the request time, the keywords, the geographic coverage, and the statistical population that's been used in the data set. Of course, you can go deeper, so there's a link to go into the technical details of the data set itself. So here is much more of a detailed description about the data set. You can see the tables that's within this data set. You can see the terms, the fields within the data set, the description of that field, and the data type of that data set as well. So you can see much more information about this. You don't get access to the data, mind you. For that, you need to go back and request access. Now, if you click on request access, you're prompted to log in, because we want to track your access process and help you get access to the data as much as possible. So I can sign in using LinkedIn, Google, and Open Athens. So some of you might have noticed during the MVP, we only had Open Athens. So there was a request from the user community to improve this. And so we added Google and LinkedIn as a sign-in process. So if I click on Google, I'm already signed in, so you can see my profile there. I can then click on request access, and I essentially am given a form to fill in. So what is my research aim? Do I need linked data sets if there are any, the data access requirements, the research benefits, and so on. And all we do right now for the gateway is send out an email to the data custodian. So this is sent to the data custodian, and that is being processed directly by the data custodians. We only track the fact that you've made a submission to the data custodian. So we can go back to the data custodian and chase if there are any issues. The one thing we are aiming to do, and Monique will lead us through that later on in the presentation, is improve this access request form to align with the 5 safes, the ONS 5 safes, and Monique will go into that in a little bit more detail. You can also go into your profile. So for example, if I were to go to my account, I'm requested to fill in my first name, email address, and institution. I can add optional information if people want to find me that way. I can go to my notifications. So these are all notifications that I get for content changes that people have requested on the content that I've submitted, or because I'm an administrator, I can get access to approving or rejecting some content on the gateway. You can add projects. So right now we're using this as a collection for the research question. So this is all the research questions that we have. So you can go directly into one of the research questions, for example. You can see who submitted it, the date it was submitted, the narrative, what priority area was, and the prioritization scores that we have collected from the community. And all of these questions are collected on a bi-weekly basis, as I mentioned before, but there are other projects that you can submit on your own. So to add a new project, for example, you click on Add Project, and hopefully the form will come up. You type in your project name, the link, the description, and any other keywords and categories that you want to submit into the gateway. This will go for approval, and once it's approved, it goes live straight away. You can also add tools, for example, so you can go into tools, same thing. So these are all the tools that we've submitted as part of the COVID-19 team. So these are all basic, straightforward links to resources that's already available online. All we are trying to do is to collect all these links together so we can start interlinking them with the data sets, projects, and other content within the gateway. Again, the same thing applies for submitting a tool. You fill in a form that supplies the link to the tool, the category, the programming languages, with a little bit more extra information that we can use to start searching and filtering the tool that you're looking for. You can also comment on tools and data sets and projects. So if I were to go to the Tracker app, I click on second review, add a review to the tool, for example, that will add in the reviews in the page. I can also start a discussion. So I want to have a discussion with the community. So if I click on the link, I'm taken straight to a page where I can start commenting on this tool, have a discussion with the owner, for example, around this tool and with the community as well. This resource is also available overall. So this forum is available for others to use as well. So if I were to go into all of the discussions within the gateway, you can see all of the discussion that's happening within the gateway itself. So if I were to go to polygenic risk score, you can see all the collections as well. This is an important point for the gateway as well. This is not just a content management system for all of the resources in the gateway. It also gives you a sense of community. It builds discussions forum around the content that you have. So this is another forum, and I think we will touch upon that later on in the presentation. So with that, I'll stop and I'll go back to the gateway, and I'll hand over to Becky.
Thanks, Sushil. So now Monique and I will take you a little bit more through the vision and a deep dive, as Sushil mentioned, on two things that we're going to be delivering next month. But like Jerry mentioned, the gateway, it's all about our community. It's all about our users. And by users, we don't just mean an innovator or a scientist trying to do research. We're also talking about our data custodians, the public, the patients, anybody who would want to see information on the gateway. And so we're keen to deliver a user experience that is good and for all user groups. So PA Consulting have been doing a lot of work with all of our different user communities, doing a lot of workshops, lots of them remotely in this day and age, and creating a representation of what the user journey, what a good user journey would be for all of the community. And as you can imagine, it is quite big and quite complex. And this is all the interaction at all of the touch point around the journey that somebody might have with the gateway. And so from this user experience that we want, we are then taking it and building our roadmap. And this is the roadmap for the first 6 months. So it's just till the end of October. It shifts as we learn and as we get feedback from the community. But this is a representation. And what I want to talk about is what we're going to be delivering next month in July. So collections and data access. And this is what Monique is going to give you more details about. But as a high level, collection, I think, is going to be a very powerful tool for different user community. If you are a scientist, you can collect all of your assets of interest in one place. If you are a data custodian, say a hub, you can put all of your assets, like Sushil mentioned, the tools, the paper, the project, the people in one place as well, and use it as a shop window for your hub to facilitate the discovery of who you are and what you're doing. And the other thing we're going to be delivering in July is the first version of the first iteration of the data access process. And as Sushil mentioned, this is all based around the 5 safes. So I'm not going to go into detail about what it is, because Monique is going to do that, but just wanted to give a brief recap on what the 5 safes are. So the 5 safes are safe people. Can the person requesting access to the data be trusted? Safe project, is a project a good project for delivering public benefit? Safe setting, is the technology and systems, are they safe and appropriate for purpose? Safe outputs, are all the outputs checked to make sure there is no personal data and identifiable data? But also safe data, is the data being released de-identified, and so there is no risk there. So this is a really rapid overview of our vision. I'm now going to hand over to Monique for a deep dive into collections and data access.
Hello. Okay, let me just share my screen for 1 second. Go. Okay, so oh, apologies for this. The thing I'm about to show you, it's a design, it's not the actual live site, so it looks real, but it's really just images with some hotspots. That takes us to the next image. We're currently in the design phase for these features that I'm going to show you, which means that it's not into development yet, although collections is actually about to go in very soon. So I think in mid-July, you'll be able to see this live on the site. The process that we go through when we design things is that we do something, we show to users or people who are likely to use this, and then we get their feedback and we make changes, and often that means that the first version of it is not quite right, and that's just the process, and that's just the way it goes. We have links to these prototypes that I'm about to show you here onto the community forum, which will send to you guys in the presentation pack. And this is all to say that although we are showing you things, they're nowhere near being ready. We know that there's improvements to be made, and we very much welcome your feedback to make changes to these, or improvements or ideas for things that we can add to make them better for you. So I'm going to show you collections. The way that you search for things on the gateway nowadays is by using the search bar, like Sushil showed you, or you can browse as well, or you can go through the most recent or most popular. But we know that sometimes people don't know quite what they're looking for, and they just like to see what's available in a particular field. So we created this feature called collections, And the idea of a collection is to have a page on the gateway with resources or data sets, tools, projects that are related to a particular topic, or maybe that they are related to, for instance, everything from a particular hub, all of the things that they've published. You'll be able to find some featured collections here on the homepage. So I'm going to show you, for instance, what the breast cancer collection might look like. You can click on this box and you get to a page, and that page just has a long list of resources that are related to this particular topic. And you can then filter those by data sets, tools, projects, and so on. And we can have, we also allow you to describe a little bit about the relationship. So why is this particular resource in this collection? Sometimes the relationship will be obvious, of course, if it's around COVID-19, then that self-explanatory, but maybe you're creating a collection that there's no direct relationship between the name of the data set and the thing. So it's a way for you to explain a little bit about what that relationship is. And you'll be able to find some collections on the homepage, and these will be the collections that we, the HDR UK team curate. They'll find the ones that they want to promote, and these will make it very easy for people to find. But you could as well create a collection for yourself. Anybody can come in here and create a collection, and so long as you give people the link, they'll be able to find it and have all the content that you put together in the same place. Right, so this is collections, and this is coming up soon. We only have a basic functionality for it now for the moment, but of course we're looking to expand that in the future. And now I'm going to show you a little bit of the data access requests. So Sushil was showing you that currently the data access request piece, it's just a form, it sends a form to the data custodian. And of course we know that that isn't the last step of it. If you've ever requested access to data before, you know that it can be quite a long and cumbersome process. There's a lot of information that you need to give to the data custodians. And we're trying to help make that process a little bit better. So this is the first view of what we're thinking about in terms of data access request. You're going to click request access. Maybe you're in a data set, you found a data set that you need. You're going to click that request access button, and you'll be taken to a form. Essentially, it's still a form, but we've added some functionality that we think will be helpful for you as the researcher, as the person making the application, to fill in the form correctly and know what you're doing, hopefully more quickly. And also for the data custodian as well, to have the ability to follow the process more closely and give advice in a way that's contextual and on time, so to speak. So we know there's a pre-submission phase where you can get a bit more information. As you can see, this is a prototype, so there's a bit of Latin in here, but you'll find some information about what it is, what's the process like for this particular data custodian. We're linking to the MRC Health Data Access Toolkit, which takes you through question by question to see what the approvals you might need in terms of ethics and so on. We're also gonna allow you to exchange messages with the data custodian. So even before you start the application process, you can ask clarifications, you can check that the data set that you're asking for access is exactly the one that you need. And you can do all those things before you go into the form. The form itself, we're following the ONS 5 safes. And the purpose of the 5 safes is to make sure that you're only being asked the questions that you need to be asked, and that you're giving the information that the data custodian needs in order to assess that the privacy of the patients or the people in the data sets are protected. And we've already gone through a round of user testing for this. So we've shown this first view of the data access request to some people, and we gathered some information. So we know some things that we need to improve. We explain a little bit more about what each of the 5 safes are in this context, as not everybody is familiar, and we'll definitely make those improvements. The way that I'm going to demonstrate with one question. So we have some features that allow for collaboration within each of these questions. They will have the same functionality as well. But if you click on a particular question on the form, you'll have these tabs that show up here. And the tabs will allow you to see first guidance. So each question will have a bit of guidance text explaining what exactly do we mean by role, what exactly do we mean by project objectives or public benefit and so on. We're thinking that there's something around allowing you to reuse your previous answers. So if you make several applications and you want to not start from scratch, but start from something that you've done before, we're going to allow you to reuse some of your previous answers. In notes, which are essentially the same as notes in Word or Google Docs, where you can annotate. We know that you don't fill in the form in one go and send it. You also may have some collaborators which are working on this with you, so you could use the notes to communicate with them, and you go, is this the right answer? Is this, maybe we should put something else in here, and so on. And you can also exchange messages directly with the data custodian. So you could, for instance, ask some clarifying questions if you're not sure exactly how to answer something. And of course, you can add other people to the application process, and they can help you fill in the form. So this is an overview of the data access request. And you'll be able to get a view of all of the data access requests that you have in the past. The way that this is going in the future is we want to help as well the process, what happens after you submit, how the data custodians review this application, what are their collaboration, what are the steps in their workflow, and so on and so forth. But I guess that's a little bit further out into the future for now. So who do I hand it off to? I guess that's Jerry, or maybe should I open for questions?
Well, hand it back to me, Monique, and that's wonderful. So thank you, everybody. So hopefully you've got a view of where we are. And as I said right at the beginning, this is very much the start of the journey. We are only 4 two-week sprints into this phase of the gateway work. It is out there, it is live, you can go and work with it today, and we want people using it and feeding back on it. And thank you also you've hopefully seen some flavor of where we're going to next. Okay, what I'd like to do now is we've had some questions on the Q&A, so I'm going to open it up for Q&A. If you have later questions, don't worry about that. The Gateway has collaboration features on it, so if you have later questions, go to the Gateway and submit them through our community forums, our discourse-based community forums, and we will continue to answer questions after the Q&A as well. So with that, I'm going to open up questions for any of the panelists. Okay.
I was going to say, should we start with, there was an interesting one on here around overlaps between data sets. So how's a way of us understanding the overlaps between the data sets there?
Okay, so I'll start with that one. Thank you, Rachel. So at the moment, the Gateway is only using metadata about the data sets. So we're not searching down into the data sets themselves. So we're not in a position to identify cohorts or overlaps of cohorts between data sets. However, it is our intention to develop out deeper semantic search capability probably later on this year into next year. And that would then allow us to have a site potentially into overlaps, or also where multiple data sets could contribute into building out a cohort. So today we're not searching into the data. In the future, that is somewhere where we will be going. So we're open to ideas and thoughts around what requirements may be useful in that space.
Brilliant. And another one that has just come in, which has got a couple of thumbs up, which is good, which is around how do we see the gateway being used for patients in the future, and what are we doing to facilitate those conversations between patient, public, researcher?
Brilliant question. So one of the drivers for me around the gateway is transparency. So we will have not succeeded with the gateway unless we have made not only the use of data for health research better, but also made it much more transparent. So there are obviously a few shorter term things, and there are a really big long-term objective for me. So it should be possible for the patients and publics to be able to see what projects are being run, what data sets are available, how these things are linking together. So that will drive, I hope, much more transparency. We have the collaboration forums, and those collaboration forums are not just open to health data researchers, they're very much open to patients and public. This is the patients and public should be part of the community driving health data research. Those who do research and innovation on health data are only doing it on the basis of trust and only on the basis that patients and public lend their data for use. Longer term, however, there is an objective I have right from the very beginning of when we kicked off the gateway, and that is that it should be possible to see how health data is being used end to end, from the discovery experience to the outputs. What is it? This health data was used, and this is what it changed in the world. These are the new treatment pathways. These are new case studies. These are new papers that came from doing that. And one day, it will take time. One day, I'd like that to even be a personalized experience. So you, as a patient and a member of the public, you can see how your health data has contributed, so that instead of there being a view of consent as a passive model, this becomes an active engagement with active feedback about what changes because people allow their data to be used for research and innovation.
Great. And then one that I think is quite interesting as well around content actually going up onto the website. So are there any requirements for contributing data into the portal, and is there any review process?
So Peggy or Shishil, did you want to take that one? Give my voice a rest.
Yeah, so there aren't any hard and fast rules around contributing data, tools, or projects into the gateway. For data, what we do require you to do is to follow the HDR UK metadata specification that we published a few months back. It's going to be reviewed this month for the next version. But for tools and projects, it's just mainly don't submit malicious links or inappropriate content. It's a very basic review that we do, but most of the time, if the content is worth submitting to the community, it just goes live straight away. There isn't any hard and fast rules at the moment.
Great. And then there's one more, which is around the approval. So obviously we've opened up the system to enable easier access and a more streamlined process, but we've got a question around the approval for safe persons. So do we have a sense at the moment of how many custodians are engaged with this, and is it going to avoid us having, as researchers, having to fill in more forms in the future for custodians in another instance?
So, so to answer that question, that's precisely what we want to avoid. We want to streamline the process as much as possible, reduce friction. So the idea is everything that you do on the gateway, we try to minimize the burden as much as possible. Again, when I say reduce friction, there will be some friction. Again, that is understandable because you're trying to access patient level data, but we're trying to minimize that as much as possible to save you from resubmitting various bits of information as you go along through the site.
And linked to that, a second one has come in around information governance training, that we know a lot of organisations request that we have information governance training. Have we considered looping that in the future to our 5 Safes model?
Absolutely. So I think there is definitely scope for adding this in and linking out to various different content that our community has already started generating around this. So the next iterations of the gateway will include links to appropriate training that people can follow, and also tailor that to the sites as well. So each data custodians would be able to specify what kind of training is required for each of their data access requests.
Brilliant. And then we've got one around business process. So we've spoken a little bit about how all of the code and everything's going to be open source, but will there be additional documentation around the application available to users?
That's a really good question, and I think we should definitely do more in this area. So we haven't published a lot of documentation around this, but that's definitely an area where we need to improve, and we will do so as we go along. That's a great question.
So as we will be putting a lot of material that we've only just started on around how to use the site. So there will be material also being added and video links. I know Monique's starting to work this area as how-tos. So we are evolving fast, so there will be documentation. Some of it will follow along because we want this to be a very agile, very swift development. So we're open to thoughts and ideas on what would be useful, because we don't want to develop things that are just there and take time but are actually not useful to the community.
Great, and then there's two more on the data access requests that maybe we could answer in one go. So one around what help is there for people as they're going through the data access request process, and secondly, knowing that there's quite a lot of scoping discussions that generally happen before we put in an access request. So something around what are we doing to help facilitate those scoping conversations as well?
So I can probably just start with the first one. So the truth is we don't really have a single service organization that'll help you in terms of helping with data access requests. We're part of an ecosystem. So HDR UK is providing the facility to discover data sets and make a data access request. You have to deal with the data custodians directly to get help in terms of what to scope down your data access requests to minimize the data that you need. There are also other organizations in the ecosystem, so MRC Regulatory Support Center is another example of the community providing this level of support into trying to fashion your research question to the most appropriate channels to get access to data. We're part of a bigger ecosystem. We're only a small part of that and growing to try and help researchers as we go along. For the second part, absolutely, that's definitely one thing on our roadmap. We will start working with the data custodians to try and scope in terms of the SAFE project, following a set of standards to try and minimize the amount of effort that's put in to scope down the projects. The cohort discovery tools that we're bringing online soon will help in that respect. So you're able to fire off a query saying, give me patients with asthma and diabetes between 18 and 35, non-smoking. That essential cohort definition can be attached to your project to say, this is exactly the data set that I'm looking for. And again, further minimization can be done as part of the interaction that you have with the data custodians. But that's something that we need to evolve by talking to the data custodians and the research community as well, because there's two sides to that. And we're trying to manage that interaction.
Great. And then one here around, do we intend to monitor and report on elapsed time through the data access request and how that might vary?
So yes, we do. This is not about a big stick, but one of the things we want to do is work with the data custodian community to improve the experience. One of the things we think we can do with the access request stuff, and that isn't where we'll be for a few months, is by integrating out with a number of the data custodians to front end their processes, we will have the metrics for how access requests progress through. We will obviously therefore be able to provide some insight to the data custodians about how those are going and where the sticky points are. We're also hoping that by the work we've been doing with the data custodian community, and this has involved the Health Data Research Alliance group, which is now 30 organizations, we will be able to drive improvement through there. So we'll be, hopefully we will improve the quality of the submissions by the pre-submission work and the discussion. By monitoring and seeing how things work, we will spot the hotspots, the problem areas, and hopefully be able to drive that through. We are also intending to progressively put more validation up front into the access request management process, which means that it should be a much smoother process, and we will catch some of the sticky problems. I think there's another question in the Q&A where people are putting in submissions that data custodian knows are likely to be problematic. We will either get those during a pre-submission discussion or by identifying them in the submission phase itself. So we will be monitoring, but with the intent that we improve this, both from a researcher point of view, but also from the data custodian point of view of actually improving the quality of submissions, so they're spending their time on the important work rather than dealing with a back and forth on perhaps less than ideal submissions.
And from a user experience perspective, we also want to do a dashboard showing you exactly where your data request is and at what stage it is in the process as well, so you get an idea of what's happening with the request. So that will come a bit later, and the same on the data custodian side as well.
Great. And then one actually looking to the future. So is the trusted research environment also going to be part of the solution?
So good question. We do not intend the gateway to become a trusted research environment, to be a point of where we hold data or we establish data lakes. We will build capability into the gateway to integrate out into trusted research environments, to be able to do extractions into those trusted research environments, to build out workspaces into those environments, to deploy tools into those environments. But the gateway itself is not a platform that will hold data itself. We're not going to be processing data. We're not going to be a trusted research environment. However, we are going to align very much with the UK Health Data Research Alliance strategy around trusted research environments, and we will be wanting to build out that integration progressively over the next probably 6 to 12 months.
Great. And then we've got one around how are the hubs linking into the gateway, and is there any plan for deriving income from dataset access?
So the hubs are integrated in. We're looking for the hubs to have all their data sets discoverable on the gateway, and for access to requests to be able to flow through the gateway. The collections work that we talked about earlier on the webinar, I think will give a great way for the hubs to group together their assets and to show off the wonderful work being done in the hubs. At this point, we are not looking at a commercial model through the gateway. So some data sets are clearly licensed. So some of the hubs we derive income from data sets, and also other members of the Alliance have models where there is a license charge for those data sets. But that will be a relationship between the data custodian and the licensee, and not something that the gateway itself will be directly involved with.
So conscious of time, I'll stop the QA there, but we will move it on to discourse. So anything that we haven't managed to answer now, we will make sure that we answer on discourse, and you'll have those links in the pack that we will share with you after this.
Okay, so thank you everybody for a wonderful set of questions. There was a few we didn't get to, and I'm sure there'll be other questions afterwards. So as Rachel mentioned, we'd like to be able to continue that discussion. So do go out onto the gateway and submit any other questions onto the discourse forums, and we will answer them and we'll carry on that conversation, because getting the feedback is really important to us, particularly at this early stage of development. This, as I mentioned at the beginning, is the first webinar. We will be running future sessions. We're thinking of running on an approximately a monthly basis, and we'll be running those as more drop-in sessions. So we will probably start with a discussion of new features to show what's going on and to get your feedback, but then we'll have it as an open discussion. So if you need advice, guidance, thoughts, or you have your own input you'd like to contribute, it will be a very open session. So we want that we'll be running those probably about monthly. We will publicize those fairly shortly. So as I said at the very beginning, and I hope it's come through as a theme, we want this to be a collaboration. So we really want the community to try the gateway, kick it, provide us constructive feedback. Not everything's going to work perfectly first time, so we want your thoughts and ideas. We want you to contribute onto the gateway, your projects, your tools, your data sets, because the more we have there, the more valuable this asset will be to the wider community. And if you want to get more deeply involved and want to help us with our thoughts, our ideas, our user research, our design activity, please do reach out to us. We really want as many people involved as we possibly can. So reach out, tell us what you think, volunteer, all very good. So with that, I'd like to thank everybody for their time this morning. I know it's been an early start. I hope it's been a useful introduction. Go out there, use it, see how it works, provide us feedback, and we want to work very closely with you to make it this part of making the UK the best place in the world to do health data research. So with that, thank you, everybody, and I hope you all have a great rest of the day. Thank you for joining today's webinar.
Thanks,
Bye.
everyone. Bye.